Good evening.
Good evening, Dr. Trehan. Good evening.
How are you, Ashwajit?
Absolutely well. How are you, sir?
So far, very good.
Looking up.
The day is still young.
Absolutely, yes.
Hey, Harsh. Hi.
Good evening, sir. Ki haal hai ji?
Harsh, are you back, Harsh? पहुंच गए क्या गाड़ी
Yeah,
में?
yeah, मैं पहुंच गया.
अच्छा.
कितने गया थी?
Sir, Mashobra.
Oh, what a life here.
अरे
What a life.
सर, ਤੁਹਾਨੂੰ ਦੇਖ ਕੇ ਅਸੀਂ ਕਹਿੰਦੇ ਆ ਅਸੀਂ ਵੀ ਇਹ ਬੰਦੇ
बंदे क्यों अपनी जिंदगी खराब करते हो?
नहीं सर, 30 साल हो गए ਤੁਸੀਂ ਅੱਗੇ ਅਸੀਂ ਪਿੱਛे ਦੌੜ ਰਹੇ ਆ.
Arvinder की हाल है? Soin.
Hi,
Hi,
sir.
Ambrish. Please look
I'm
in.
good. How are you?
Perfect. So we're all here. I think we could.
Yeah. We are here in full strength. Hey, Harsh.
Perfect. So we can start then. Great.
So Ambrish, you're a what night?
He's not, sir. He's, in spite of that, he's reached the top of his field. That's what I was thinking.
That is true. That's true. They always have outliers.
नहीं सर, नहीं. I'm a dip side, sir. I'm a dip side.
They are the two exceptions. Harsh and Amrish are the two exceptions.
वो मॉडर्न स्कूल है ना, वास्ते एस्पिरेशन ही रह गई.
Okay, let's start. Right. Good evening. Anil, we are going live now. Faisal, yeah?
Yeah, live, sir. Please. Thank you.
Good evening, ladies and gentlemen. On behalf of Mera Doc, Heart Care Foundation, London School of Economics Alumni Group, Modern School Old Students Association, and IP Global, I'd like to welcome all of you, and especially the panelists, to this very important discussion around COVID and comorbidities. Before I introduce the panelists, I'll quickly talk a bit about Mera Doc, which is a startup which has been launched during COVID itself. It's still to be launched, which is going to be focusing on personalized telemedicine solutions to connect highly experienced GPs and related services to the patients, because that has emerged as a need. We are also very happy that the Heart Care Foundation, Dr. K.K. Agarwal's foundation, who did a lot of work for COVID in terms of creating the awareness around COVID. His foundation has also joined hands with us in this, and his legacy is being taken forward by his children, Naina and Nilesh. This is also being streamed live on all their channels, and they have about 100,000 followers, so it's going to be streamed live on their channels as well. Our other partners are the London School of Economics, Delhi Alumni Association, and LSE has also been doing a lot of work around COVID and COVID camps, the Delhi chapter especially. So they're also here. And IP Global, of course, of which I'm a managing director. IP Global is also working a lot on the COVID-related work. We work in the development sector, especially in the health sector, and we are managing the entire technical support for private sector funding, the emergency relief that the US aid is providing as part of Wave 2. It's through a program called Samrit, where they're actually giving grants and blended finance facility to any private sector player who's looking at expanding or trying to meet the challenges that might be faced going forward in creating health infrastructure and communication in COVID. In fact, if I was really asked to, or any of us were asked to look up a Dream 11, because now is the time of cricket, a Dream 11 of top doctors who could talk about COVID and comorbidities, I think the three doctors that we managed who've consented to be part of this today would feature in any Dream 11 that anybody across India would really put together. I'm extremely grateful to all three of them for having consented to be with us. Although they need no introduction, I will still so quickly talk a bit about them. Dr. Naresh Trehan, of course, everybody, I'd be surprised if anybody who's got anything distinctly also or to do with the health sector would not know of. But Dr. Naresh Trehan is the chairman and managing director and chief cardiac surgeon of the Medanta. He pioneered heart surgery in India and has earlier set up the Scots Heart Institute. That was the time when people from India used to go overseas to get any kind of heart surgery. And now we've actually got a reverse flow in India where people from Africa and a lot of other countries, including developed countries, actually come to India to get heart surgery done. He served as the personal surgeon to the President of India since 1991 and has received numerous awards, including the Padma Shri, the Padma Bhushan, the Lal Bahadur Shastri National Award, and the Dr. B.C. Roy Award. He is, of course, a distinguished modernite and also, on the Wall of Fame of Modern School as well. And I'd like to mention here, Dr. Trehan, that before this Dr. Trehan became so well known, there was another Dr. Trehan who was equally well known in the ENT space. And I remember having gone to him right from childhood to his clinic in right near Plaza in Connaught Place. And he's probably till date the only doctor I've actually looked forward to or enjoyed going to. He was full of life, one of the most humorous persons that I remember. I have very fond memories of him. And I still remember him having telling us about his son who was in New York, doing cardiac surgery. And little did we know that that son would come around and turn the entire sector, the private sector, and make India one of the pioneers in the space of cardiac surgery. We've also got Dr. Arvinder Singh Soin, who is the chief liver transplant surgeon and chairman of the Institute of Liver Transplantation and Regenerative Medicine at Medanta. Avi is, of course, a Padma Shri awardee as well. And he's been pioneering the liver transplantation in India. In fact, he has the distinction of having done more than 3,500 living donor liver transplants in India. And this is the highest in the country and the second highest in the world. So we are very pleased that Avi, who's of course, again, a friend right from school days, we're thankful to Avi for being here as well in this important discussion. We're also extremely happy to have Dr. Ambrish Mithal, who is an Indian endocrinologist and chairman and head of endocrinology and diabetes at Max Healthcare. He again has been honored by the government of India as, with the Padma Bhushan in 2015. And he's the first Indian chosen for the Laureate Award for International Excellence in Endocrinology. So we've really got, I'm the only one who doesn't have a Padma Award out of the panel. So you can imagine how distinguished the panel is. We've got two Padma Bhushan, a Padma Shri. I'm sure that's going to be a Padma Bhushan soon as well. So we're very, very pleased to have them. Coming to our specific topic, we've already got a lot of questions which have come through us during registration, but we would also request all of you to please, keep typing on your questions on Zoom, and we will then address these. I'm going to be requesting each of them to speak for 5 to 7, 8 minutes on their field. But let me, Wave 2 has taught us a couple of things which we did not know. First of all, it suddenly taught us that the fatality really is much higher than we had seen in Wave 1. It also taught us the poor infrastructure that we have in the country. It again told us that all ages are vulnerable, and it's not that it only happens to the old or just the people with comorbidities. It also told us that while vaccination is a must, but it may not be enough, and we need to continue being very careful. And of course, it taught us that the variant can continue to change, so we cannot assume it's over, and we know that it's still not over. Of course, the next wave has a lot of challenges which are there. We are already planning for it. And I would particularly like to focus on not only the government, but the private sector as well. And the development financial institutions are working on that. Vaccination is important, but there are a lot of risks related to that. A lot of questions that we've been asked are related to risk. And of course, how would the new virus or mutant really take shape in times to come? One of the biggest concerns that people have is, it's a known fact that people with comorbidities have a much higher possibility of getting into trouble. A lot of people in this particular wave have not got okay even months after they've really gone through this virus. They're still having issues around sugar, issues around diabetes, issues around heart ailment. So there are a lot of questions here. So what I would now, straight away, without taking more time, I would request Dr. Naresh Trehan to really give his opening remarks. And I would also, since he's also a leading private sector player, having promoted Medanta, I would want him to divide his opening remarks into two parts. One is, what is the role that the private sector as a community is capable and should be playing and is geared up to play in what could be the next wave? What are the challenges they are facing? That's the first part. And of course, coming back to the second and the direct part to his field of specialization, there are a lot of questions around, is it riskier for heart patients to have COVID? A lot of people are fearing they'll have strokes. They're having issues around that, post recovery issues as well. So over to you, Dr. Trehan, to please give your opening remarks.
So good evening, all of you. Thank you, Ashwajit. You told a whole string of truths when you stated all the facts that we are facing today. If you come circle around basically to say what has happened in first wave, second wave, and what do we expect in the future, the most significant part that happened between the first and the second wave, which should not have reached this peak that it did, and with the speed and ferocity that it did, is because of the fact we actually invited the second wave. We helped it along to go to the height that it went. And if we repeat that behavior again, then God help us. So we did not leave any stone unturned, including all the religious events and the social events and the political events, that they all coalesced into a massive mistake. So one, like you've said already, that people suffered as they went along. In between, people have not gotten better even, and if there were any misconceptions about the severity of the disease and what it does to your body, and for the length of time it does to your body, the second wave has actually given us a shocker to say there are people who for 5-6 months have still not recovered. So now the question is, well, how do we take it into our own mind or brain or DNA to say, what have we learned and what are we going to do to prepare or to deal with the third wave? So these different aspects are very clear. One is, of course, personal behavior. That personal behavior definitely will be the key. In addition to that will be the way vaccine is rolled out. If you look at the modulations, it is clear that if we can start by the 1st of July, start vaccinating upwards of 50 lakh people a day, we can blunt the third wave by 20-25%. If we can reach the target of by mid-July to 70 lakhs per day plus, we can flatten the wave less than 50%. And if we can by some chance by the end of July reach 1 lakh a day, we may actually flatten the wave. So that's the contribution of vaccine in two ways. One, of course, we are saying that it gives you the protection. The second, as you know, that there are upwards of 30,000 variants roaming around today. And the variants, the way the virologists explain it is that the variants mutate as they multiply inside the body. So the theory behind it is that if you limit the number of bodies that get infected, and vaccine seems to be effective in actually preventing infections up to upwards of 80%, then that 10-15% who get infected and get infected in a mild manner, they do not give the virus enough opportunity to multiply rapidly. And the fact that every time it multiplies, there is a possibility of a mutation, that process can be stymied over a period of time. That's the theory. The virology theory right now is to say, if we are going to vaccinate enough people, we may be able to overcome the third wave and have a smoother road ahead as we go forward. So that's the lay of the land as far as number of people get natural infection, develop enough resistance or antibodies, or the ones that are vaccine mediated and develop the immunity, that if we put them together and enough bodies are vaccinated or immune, then we may be able to get a better outcome in the times to come. So we are estimating 6 months, you're not going to be able to change your social behavior. Those 3 things that we talk about have to be continued with even more intensity today than we did between the first and second wave. The second fact that has emerged very clearly is the mortality in younger people below the age of 50 is double that of the first wave. So that means the severity of the disease that affected the younger age group is much higher than what was before. Coming down to my own field. So if you look at it, the whole mystery was unraveled by the 50 autopsies done by the doctors in Bergamo, Italy, who actually demonstrated that it was a 3-phase phenomenon. The fact that the viral multiplies and does damage to the body is only one part of the problem. The cytokine response or immune response of the body is the second problem, and the degree with which it actually appears in the body is responsible for most of the damage. Because yes, virus we knew always will affect the lungs, but they found the virus in the kidneys, in the liver, in the heart, brain, everywhere. So that whole myth was gone that it only affects the lungs. So coming down to the heart, they also noticed that 3 types of things happened. One, of course, the fact that inflammation caused the capillaries to thrombose and create massive heart attacks. Second, that the muscle itself was inflamed, that you could see, and we even till today on MRIs and echoes, we can demonstrate how the inflammation in the myocardial fibrils has happened and how it is sustained over a long period of time. The third thing was that it definitely does affect the electrical system of the heart. The entire system gets affected in many, many people. So the outcome of that is that many people with the mildest of infections will have tachycardia or bradycardia or irregular heartbeats for many months. So we are seeing it 3-4 months, we are still seeing people coming with tachycardia. So that, and if you look at their cardiograms, you can actually demonstrate the changes. The second thing is that their myocardial function comes down. From normal, suddenly it can drop to 20-25% and people die. We've seen many young people go away because of that. And the third is the fact that in the electrical system, the arrhythmias that it can cause has killed many people because of that too. So basically, it's a pan-inflammation of the body. We have designed a complete program, Road to Recovery for long COVID. So we will do the appropriate tests as we go along, including intensive cardiac, pulmonary tests, and any other abnormality that they may have been produced. And also be very careful that you should look for secondary infections, which are very important because we say the people have got negative with COVID, their chest X-ray, their CTs are looking better, but then you will see them coming with pneumonias because of the fact that we let them loose. So we have to warn the patients that any change in symptoms when they go home requires immediate attention, because you should not let any of the secondary problems that may occur actually carry on and threaten your life. So basically, that's the lay of the land that I know. And I know we have most knowledgeable people on the screen here, and they will add much more than I can add right now. But any specific questions, I'll be happy to answer.
Thank you. That was very enlightening. Just a quick follow-up before we open it. Of course, we'll have the general questions at the end. People already typing in. One is, how prepared would you say the government and the private sector is for wave 3? Because I think by now we are more or less everybody's quite show that there would probably be a wave 3. So how prepared are we? What are the challenges there? And then again, specific to your field, a lot of people fear that they could be clotting, there could be, fluctuations of blood pressure. There are questions I've got from people who said that we used to have high blood pressure before COVID. Now after COVID, we've got low blood pressure, chances of a stroke. How severe are those for a heart patient? And especially also the fact that they can't exercise.
So I said, basically, it starts with the inflammation that we talked about. If you are an already existing cardiac patient, the chances of precipitating a heart attack because of increased coagulability of your blood can, of course, precipitate heart attacks. And we have seen many, many of those. And then the ones who come in time, you take them to the cath lab, you will see over pre-existing disease that there are acute clots formed. You can actually save those people and save their heart attacks if they get on time. The second thing is that if you were to say, how do I, important part, I'm telling you what our observation is, that people who are used to exercising, if they have gone back into their exercising pattern too soon, and it's a relative term, too soon, they have suffered hugely. Every once in a while you'll hear, but we hear all the time, that 45-year-old, 50-year-old boy, people who just went, just recently we lost a friend, he was bicycling. I mean, he had COVID a few months ago, but then again, the diagnosis was arrhythmia. So the point is that you can get, if you have stents, you have to be careful. If you have had previous myocardial heart attacks, you have to be extremely careful. You'll see reverse very often, that if you don't have any high blood pressure, that you develop high blood pressure and it will last you several months. And then, of course, the mucormycosis is always hanging over the head, and that is another big problem. So there are many, many side effects, and like I said, how prepared we are to answer your question. Look, we thought after the first wave, we were very ready. We had all the knowledge, we thought we had all the stuff, but every day new things happen, and the ferocity and the velocity with which this second wave came, nobody expected. So we were caught off guard. Especially it was then, first it was beds, then it was oxygen, then it was intensive care units, because a lot of them got so sick that they went to ICUs. And then we have, on top of that, now we have mucormycosis. The only game changer that is so far looking very good is the fact that if somebody, God forbid, gets the infection today, you test RT-PCR positive, the monoclonal antibody cocktail, which consists of 2 antibodies, has been found to be very effective in reducing extremely effectively the viral load. Consequently, most of the people will not have to go to the hospital, and it's just last night another study came out which also showed that it reduces the death in these people who are the vulnerable people by 70%. So that may be the new weapon that we have, in addition to what we are looking forward to vaccine as a more permanent solution. But antibodies, so far, all the studies done, including our own at Medanta, we are inoculating or administering the antibodies to anybody who has within the first 7 days of getting the symptoms, or as soon as after the RT-PCR comes positive. You can have this as in the back of your mind, that if it is given, it may save that person a huge amount of misery by hopefully 90% will never need to go to the hospital, and the 10% who go, 70% of them will get better and survive.
Thank you so much. I think that was very enlightening. Let's move over to the liver and kidney expert, I think, right after the heart. Dr. Arvind Soi, I think, Avi, I would really want you to talk about, because a lot of people are concerned about the impact on the liver and the kidney. How does COVID affect the liver and the kidney? What are the symptoms? What are the gastrointestinal and liver manifestations of COVID-19? What do patients with pre-existing, disease, how do they handle that? Should they be going in for liver transplants during COVID? How safe is it to go to the hospital? So there are a number of issues around that, and I'd like you to give your opening remarks as well, please.
Thanks, Ashwajit. It's a pleasure to be here on this forum today. So amidst all the gloom, let me first say the positives, if there are any. And I think there are, because we've had a lot of learning, and I know we've lost some precious lives, and that's very sad. But the good things are that we know how to treat this virus much, much better than we did in the past year. So for the third wave, if that were to happen, and it's likely to happen, I think we're going to be able to flatten it compared to the second wave because of many reasons, some of which have already been clearly spelled out by Dr. Trehan. And some among those are that we are better prepared for handling children with COVID. We had a lot of cases of young people getting COVID this time, and we're probably going to have many more in the third wave, but now we are geared up. There are pediatric beds being made available. There are pediatric protocols of treatment which are being circulated countrywide, so, and ICU facilities being ramped up. So we will be better equipped. The second thing is that we'll be better equipped in terms of essentials, specifically medicines and oxygen. Those systems have been sorted out. So if there were to be a third wave, I'm sure we'll be able to deal with, the sick patients much better on these counts. We have more beds, ICU as well as non-ICU COVID facilities, and some of them were temporarily created, and these are going to be kept in anticipation of the worst, but hopefully we won't have that. So we'll be better prepared from that point of view as well. And then, of course, everything about the variants and the mutants is not bad. 2 doses of vaccine still work to prevent severe disease and death in more than 90% of the cases. So that is something we must take notice of. And of course, Dr. Trehan has already spelled out that we have this monoclonal cocktail by the Regeneron, Cipla, as well as Eli Lilly, and these will prevent hospitalization and severe disease in 70 to 80% patients if taken in the first week. So, these are the positives. If you can take any, these are the learnings from the first and the second wave, and these we take into our hands as we move forward. And hopefully, of course, the biggest silver lining is that the government has their hands on a much, much healthier vaccine stock now. So, the Serum Institute and the Bharat Biotech are going to ramp up their manufacturing capacity to a total of nearly 18 to 20 crores a month by August. So, Dr. Trehan spelled out some numbers of how many vaccines we should do every day, 70 and then 90 lakhs a day. So that's going to be a reality with these numbers of vaccines available. Novavax, which India has actually envisioned to have 1 billion doses of, is showing excellent results in trials. There is more than 90% protection, even against the new variants. So that's a positive. And that's going to be manufactured by the Serum Institute as well in India. And we're going to have millions of those doses. So I think everything put together, we will see, us coming out of this pandemic and getting, over the next few months, hopefully. So with those positive remarks, I'll then now switch on to the GI and liver and kidney disease that you want me to talk about. So now, I think the first thing is that patients who have any evidence of liver disease have to be extra careful in preventing COVID from happening to them. And prevention is general, obviously the usual etiquette for COVID appropriate behavior, which everyone knows, but still half the people don't practice, and that's avoiding crowds, physical distancing, proper masking, and hand hygiene. And then in terms of diet, strict no to alcohol. People who already have liver disease should not be taking alcohol. They should control their weight. They should control diabetes and lipids if they are abnormal. And they should be going for regular checks to their doctors. And then what is a liver-friendly diet is a question I get every day in scores on my WhatsApp. And I think that they should take more nuts and fruits and vegetables and garlic and fish and sunflower and olive oil and whole grain wheat and some tea and coffee in moderation. A no-no is all kind of sugary and salty diet. And of course, I already said no to alcohol and white bread. Even rice is not that great. So these are the food tips. And then if somebody already has liver disease, we, as a part of 3 global registries, have actually seen that about 15 to 20% of them will progress to more severe forms of liver disease if COVID strikes them. If they already have moderate to severe liver disease, unfortunately, there is 10 to 15% mortality. Now, as you know, the mortality of COVID in general population is between 1 and 3%. So if somebody already has moderate to severe liver disease, then they have 10 to 15% chance of dying. And we have, in our more than 400 patients, we actually written a paper on this and published it, have found a similar mortality. I think it was 14%. We are part of, like I said, 3 global registries which have the same results. So what I have been advising patients of moderate and severe liver disease is that they should actually go in for a transplant, because again, in our data, as well as the global registry data, I'm a stickler for data. So I'm not just giving you my opinions. I'm actually telling you about data that is published. So there is a mortality of about 5 to 8% among liver transplant patients, which is, as you can imagine, half of what it is in moderate and severe liver disease. So it's much better to actually have a transplant if one is suffering from moderate or severe liver disease and one is a suitable candidate for transplant, and if one can, have access to it, rather than just sit at home waiting for COVID to get over and, landing up into trouble because of COVID and severe liver disease as a comorbidity. Vaccination. Now, even though I have personally written emails to all my patients who have liver disease or have had transplants that they should go in for any of the 2 vaccines available in India, I still keep getting personal messages. Doc, I'm thinking I'm traveling. Should I have the vaccine? I'm thinking I'm taking this medicine. I'm taking aspirin. Should I stop this? Should I have the vaccine? The simple answer is, the vaccine is most important for people with comorbidity, and chronic liver disease and chronic kidney disease, especially if you're on dialysis, are the very reasons that you are at high risk from COVID, and you must have vaccination and full 2 doses of it. And of course, Covaxin is spaced by a month, and people who have Covishield can take it, 12 to 16 weeks apart at this point in time. But if you are actually going to schedule some surgeries or traveling abroad, then the government has allowed you to have it earlier. So yes, please go in for that vaccine, because it's going to be your biggest protection against landing up with severe COVID. So with those remarks, I'll now touch upon what happens to patients when they have no liver disease and they get a COVID, and then they will get an abnormality of their liver test, their alkaline phosphatase or SGPT or SGOT goes up, and then they come to us in a panic situation. Well, the liver also has the same sort of cells, that's the ACE2 receptors, that the lung has. So the COVID virus attaches itself in the liver. Like Dr. Trehan said, it's a systemic disease. There are lots of organs in the body where the virus can actually lodge. It lodges in the liver as well. But luckily, liver has a lot of reserve. So although there may be some inflammation in the liver, and people may get modest elevation of SGOT, SGPT, alkaline phosphatase, sometimes even bilirubin, usually in more than 97% of the cases, this is pretty harmless. Unless there is a pre-existing liver disease, they're not actually going to be materially affected in terms of having a liver problem because they had COVID. COVID-related liver failure in a previously healthy individual is almost unknown. So you will have elevation of liver tests for maybe 2, 3, 4 weeks, and then they will slowly settle down. If you see a liver expert, they're going to give you some liver supplements and nutrients, but there is nothing to worry if the liver enzymes are up because of COVID. That's the least and the last of your problems, right? Now, a word about kidney disease. Now, chronic kidney disease is another reason why you could be more susceptible to severe COVID. And if, God forbid, one gets COVID, then one can have a higher mortality from it, with or without dialysis. So again, please do not hesitate when when you're thinking of vaccinating if you have kidney disease. And all the people with comorbidities need to up the frequency with which they're following up with their doctors, whether it's heart disease or kidney disease or diabetes or liver disease. Because obviously you need to control it. You see, if you have, and Ambrish will bear me out, if you have diabetes which is well controlled, that's much less of a risk than a poorly controlled sugar. So similarly, if the liver disease is well controlled, that's a lesser risk. And if the liver disease is out of control, hepatitis B or C or a cancer or any other form of liver disease, whether it's fatty liver disease or alcoholic liver disease, then you're in more serious trouble. And that's why you should keep seeing your liver and kidney and heart experts regularly. So those are the few comments I'd like to people to take home as a message. I'd be very happy to answer any questions.
Thank you, Dr. Soin. That was again very useful, and I'm sure a lot of questions have been answered. But while you and Dr. Trehan have been speaking, quite a few questions are being typed in the Q&A. We'll of course go back to those. I will read out some questions. It might be useful if you might want to simultaneously scroll through those so you can straight away know which are the ones relating to your field. Coming now to Dr. Ambrish Mithal, I think perhaps if it is any indication on what is an area of maximum concern as far as comorbidity is concerned, based on the number of questions we got before the webinar, it's probably around diabetes, around sugar, around black fungus. A lot of people have been complaining about sugar going up post COVID. A lot of people have been, of course, complaining about you have to take steroids as one of the most important treatments for COVID. That in turn leads to fungal infection, black fungus. That in turn could lead to antifungal treatment could really lead to kidney failure as well. So a lot of these comorbidities are linked. So what should a patient do when he's got these symptoms? We've got questions where people are saying that even months after recovering from COVID, they still have fluctuations in their sugar level. They never had diabetes before. What should a pre-diabetic patient do? What should a diabetic patient do? When should they? When and how often should they get tests done? And what are the other related issues? Over to you, Dr. Mithal, please.
Thank you very much, Ashwajit. So it's a pleasure to be here. And to give a background, we have to look at it in like two sort of separate areas. And that is, they're interlinked, but at the same time, they're separate. What is the impact of COVID on people with diabetes? And what is the impact of diabetes on COVID progression and outcomes? Right? So it's a loop. What does COVID do? So supposing let's talk of the latter first. Supposing, someone has diabetes, pre-existing diabetes. Their chances of contracting the COVID infection, corona infection, are not significantly higher. It hasn't been shown that. So that's number one. People think I've got diabetes, I'm going to get hit by COVID for sure. Not true, right? But if they do get COVID, then their chances of poorer outcomes are higher as compared to someone who does not have diabetes. That we all understand. At the outset, we need to know, what does this mean? This means that if you have diabetes, then your chances of getting hospitalized are higher. If you are hospitalized, then your chances of getting into the ICU are higher, and subsequently whatever. So there is a risk of adverse outcomes. And in our own data, which we published in December, of 401 consecutive patients who were hospitalized last year in August, September, we found that diabetes was a significant predictor of adverse outcomes. Right? So, and even the admission HbA1c, which is a 3-month average of your preceding 3 months, so blood glucose average of the preceding 3 months, that correlated with outcomes. So it did seem that diabetes had an impact on outcomes. But again, as Avi very rightly pointed out, you don't put all diabetes in one basket. So there are people who have relatively recent onset diabetes, or even if it's long duration diabetes, there are people who have well controlled diabetes without other comorbidities. And such people actually are almost as good as someone who doesn't have diabetes. So the ones at risk that we found even in our study were the ones who had multiple comorbidities. Okay, so for example, if diabetes is poorly controlled, of course, age is an important factor in determining outcomes. But if poorly controlled diabetes exists, diabetes with vascular complications exists, like, of course, as already discussed, kidney, liver, heart, it has a huge impact on outcomes. Uncontrolled with comorbidities, even diabetes and hypertension together make a much more potent mix for poor outcomes than just diabetes. So it's not just the blood glucose that's doing it. If you control your blood glucose well and keep your other parameters in control, like blood pressure, etc., simply by connecting with your physicians regularly, which is now possible in most cases by telemedicine and the use of remote consulting. In our field, in endocrinology and diabetes, it actually lends itself very well to remote consulting also. So if you can keep your parameters within a range, then your risks can be substantially reduced even if you get hit by COVID. So this is the connection that we have. What happens if a person with diabetes gets COVID? What happens with if the other thing that happens is that the sugars worsen. There is no question about that. What COVID does to diabetes? It worsens the sugars, and A, any infection worsens the sugars. B, any serious infection, a severe infection definitely has a greater impact on sugars and stress, hyperglycemia, not just in infection, but in Dr. Trehan's patients in the wards, we have seen in Avi's patients who are otherwise healthy, when they are very stressed in their physically stressed by their medical condition, their sugars tend to go up, right? So you have that. So one is just any infection, then the stress of any disease, acute disease. And thirdly, it is possible that the virus itself may be playing mischief there. Like other parts of the body, there have been studies now showing that the pancreas may be directly hit. Last week, a study again came out showing an autopsy study showing that the pancreas of people was impacted by the virus. Pancreas is involved in insulin secretion. And the last point on that is that steroids are the most commonly used agent, which are actually, if used correctly, are life-saving for our patients during COVID. And steroids have a huge impact on diabetes, on blood glucose. So even people who have not had diabetes, who are either in the pre-diabetic zone or not even in that zone, sometimes can get high blood glucose when they are given these high doses of steroids, especially when they are hospitalized. And one of the big challenges this year was that many of these patients could not get hospital beds. So through remote consulting, patients on high doses of steroids, home oxygen, we were managing people with blood sugars of 300, 400, teaching them insulin, how to monitor, but it worked. Let me tell you that if you get proper advice and if you follow it, even with severe hyperglycemia, we call it, very high blood sugars related to COVID and steroid, it is possible to get a good outcome. So, of course, we all know that this virus sometimes behaves in a very funny is not the correct word, in a very strange way. And sometimes it belies all predictors, and it just does its own thing. But by and large, you can reduce your risk very substantially if you follow that. So remember, one important point before I hand the mic back to you is that the prevalence of diabetes in India is very high. And we are actually looking at what we call a syndemic. A syndemic is when two epidemics converge, like when two things converge. So we already have an underlying sort of epidemic of diabetes. You know that in Delhi NCR, where we are talking right now, the prevalence of diabetes at the age of 40 would be above 20%, 20-25%. And the age of 60, it would be like 35-40% of people are already diabetic. So imagine in this fertile field for the COVID to grow, you sprinkle this, throw this COVID virus all around. On the other hand, if there was a population which had a diabetes prevalence of 2%, like India had maybe 50 years ago, okay, then the impact of COVID via the diabetes mechanism would be much, much less. So this is actually a wake-up call for us that unless we deliver chronic care better, we'll, whenever in subsequent, God forbid, any epidemics or pandemics, we'll be hit much harder. So therefore, it's important for us to do both things together, not to panic if we have diabetes, but controlling it well, even without COVID, and making sure that we reduce our risk. If you're overall healthier, our risks will be much less from getting impacted by COVID.
Perfect. Thank you so much, Dr. Mithal. I think that's clarified a lot of questions. I'm just going through the questions as well, but I think the opening remarks of all three of you have addressed a number of questions. And now that we've got another 15 odd minutes left, let's just, a lot of questions have been already typed in. If you'd like to pick up any, but I would just maybe pick up a few. I'll read out the questions, and then you depending on who'd like to answer that. There's a question around the black fungus cases in kids in Mumbai. Somebody's Ria Sethi said that her son is 9 years old and recovered from COVID. She wanted to ask if he's still open to infection as the reason fungus is not provided. How much of risk is he still at? Then we've got another question that people say that COVID is airborne. I've not been going out. I've been advised not to go out to parks as well. If I don't exercise, then how do I keep fit? If I don't keep fit, it's a catch-22 situation. I can still have my diabetes gets affected. My heart situation doesn't improve. There are some questions around people who had the first jab of Covishield or Covaxin, and now they're wanting to know whether they can have the second jab of Pfizer if it's available. And of course, I'll take one more question, and then maybe we'll take another lot after that. The question around blood clotting as well. I think that's been addressed. Yes, there is a question around Dr. K.K. Agarwal had both doses since they are part of this, partners in this. So what happened? I mean, because that was a great loss to the entire medical fraternity. And there's a question around somebody's, Rachna's mother, who's 85 years old, recently COVID recovered, negative after 4 weeks, but a bilirubin raised with days, 2.5, 3 days later, 5 another 3. Hepatitis tests are negative, ultrasound is clear. So what is the problem? So maybe we can just open out with these questions and we'll take a second round. If you can, I leave it to you to answer.
So I can answer the Mucor question. So I think the risk of a 9-year-old child getting Mucor is post-COVID is really very, very low, unless the child is an insulin-dependent diabetic. Before COVID hit us, mucormycosis was largely a disease of insulin-dependent diabetic children. In my previous assignment with my colleagues here, we've handled intestinal mucormycosis. We had the team staying there 24/7, reported those cases, cutaneous mucormycosis, all kinds of rare things. But that was once or twice a year. What has happened with this is that the excessive use of steroids, if I may say, some necessary, some excessive, along with less attention to diabetes, especially in centers which are not particularly well equipped for that, has led to proliferation of this normally occurring fungus in our nasal mucosa cavity, and then progressing to the eye and brain and whatever. So in a 7-year-old child who doesn't have diabetes, and if he has recovered from Mucor, it's completely all right. The risk is very low. Of course, if he complains of any specific thing like a nasal discharge from one side or a bloody discharge or pain on one side of the face or eye, one should see an ENT. But I think the risk largely is in people who have diabetes. 80% by and large worldwide, the data suggests, are people who have diabetes. 76 to 80% are those who have received steroids. These are the two proven factors for Mucor. Otherwise, people are speculating lots of factors. But these are the two factors that are very well proven. And if one has taken care of these things, then mucormycosis should not, really scare you. That it's a scary disease if it happens. No question about that. It's not a good disease to have. But nevertheless, if we are not in the high risk zone, we shouldn't keep worrying. And I get so many calls about this. I've got, some little pain. You think I could be having Mucor? So it's not It's still not common. It's far commoner than what it ever was. But in absolute numbers, it's still not common. And for somebody who doesn't have all these things, the risk is very, very low.
And what about the airborne? How airborne is the disease? Should they go for walks?
So,
is it safe to travel on flights right now? What about air conditioning? Can they go to office and have the air conditioner on?
So see, everything is relative. You have to weigh your risks with what is involved. So open air walks are absolutely safe. Open air walks with masks, it's not that the virus is floating around in open air. There are very few documented major outbreaks in parks and all, unless people are congregating and taking off their masks to have a meal together. So I actually, for one, have always been advocating, and you may have read some of that why are the parks not open? I mean, you have to get actually people out. In closed indoor environments is where the virus spreads. Open air, and just wear a mask, a proper mask, and you're pretty safe. Don't do it, make it a social activity, as many of us like to do. Go for a walk on your own with your phone or whatever, or iPod, whatever you use. And I think it's the best thing you can do. Don't interact socially with people. So open air walking is not a problem, provided you wear a mask and don't engage in social conversation, just hi and how are you types, that's all right. Just crossing each other, you will not pick up the virus. So I think that's very, very important messaging. It's much worse to meet family members who've come from outside, guests who think you are there, your own, and unko kaise hoga, wo to apne hi hai sab, and have them for a cup of tea in your house. That is far more dangerous than going out for a walk. And of course, people can, as Dr. Trehan will probably, he's an expert in that, can exercise very well at home. I mean, there is no question. If people are not able to go out for some reason, or don't live in an area where they may not be living in an area where there is enough open space, then definitely they can exercise at home. We all know the benefits of pranayama and yoga and exercise at home, so there is no question. But exercise is a very, very important tool to build your lungs and protect yourself from COVID or the adverse effects of COVID.
Right. Thank you.
From that point of view, Surya Namaskar is a complete exercise in itself. So yes, in extreme terms, that is something you can fall back on. But as Dr. Mithal said, there's nothing like a walk in the fresh air. But there is no fresh air in Delhi. You're probably exposed to so much pollution on some days that it actually negates going out. But anyway, I would like to talk about the mixing of vaccines. So there is a lot of interest, first of all, not a lot of data yet, but a lot of interest in the fact that can you enhance the immunity of an individual by combining two platforms. Platforms being like, so there is some work done in UK on AstraZeneca and Pfizer, and also Moderna. There is a study going on in Brazil right now. There are studies being done. We've started something in India also. So the basic thing is that with mixing of vaccines, there have really not been any major adverse events. So there is some data which says that if you mix the vaccine and like the Pfizer or Moderna that were used as the second dose or even as a booster dose at some point, what you saw was people did get 1 or 2, 3 days worth of fever, headaches, and some shivering. So but that's not a frequent thing, but fair number. So one should be ready for some kind of reaction if you need the booster. Now, the whole controversy revolves around antibodies. Are antibodies in themselves an indicator of your immunity or not? So that's debate will only get settled because if you look at the physiology and the science behind immunity, it says that there is for short term, antibodies may have much more relevance than for the long term, because long term resistance or immunity is stored in T cells and B cells. So that's what we call memory T cells. So cellular memory is probably more effective, like we see in many other forms of immunization. And that is something that unless enough data comes out, which is in progress right now, you wouldn't know 100%. But the ones that we know who have gone and mixed their vaccine after the first dose have done perfectly okay. We don't have enough people who we know, but there are studies going on. There's a large study being done right now that after 2 doses, is it a good idea or not? We don't know. So there is a lot of concern in people whose antibodies are not either the body are not developing or vanishing real fast. They are the ones who sometimes get anxiety. But the worldview is that you should not depend on antibodies counts, and most of the world is not doing that. But in India, it has become a little more of a talking point to say what is your antibody count, and more so in people who are in the social circuit. So there is still confusion, but the data will tell as we go forward. Now that also, see, I'm like on the Supreme Court committee, that National Task Force for dealing with the current problems of COVID, infrastructure, supplies, and preparing for the third wave. So there's a lot of work going on in our committees, and the blueprints are being written. So oxygen, you can say, was the first terms of reference that the court gave us. We've done a lot of work on that, and I think we'll be prepared for any eventuality, even if it goes above the last wave. So there has been a lot of groundwork done by way of reserves, by way of variety of sources for oxygen, including with the oxygen generators, concentrators, all that other stuff. I think we can deal with it much better. But then, as you saw, the critical pharmaceutical supplies, like nobody anticipated that we would get the mucormycosis, better known as black fungus, in such quantities that we will not have enough amphotericin. I mean, so it's been one nightmare after the other. Of course, we'll block all these things. But the main thing is to say, okay, COVID-appropriate behavior, repeat that thousands of times. All of us should do it. We should practice it, and we should say it, because that is our main weapon. But at the same time, we have listed the entire need for children. God forbid that wave comes. So that is already in progress right now. We are about to submit it as a report of the National Task Force to the courts very soon. But I think one thing I can say here that I've found from the inner sanctums, that the government is working very hard on trying to tackle these problems. So it's like it may appear, which it does because of the sheer size of our population that we are wanting, but I'm not sure any country could have dealt with this kind of situation that we had. As 4 times 4 lakhs a day is a mind-boggling figure. United States was buckling under 250,000 cases a day. So the fact that we survived, there's a lot of misery. Yes, many people were in very bad shape on the streets. But otherwise, overall, I think we have coped with it well. But today, if we do not keep up our guard, it is not going to help us in the future. So I think you stress it again and again that the virus is still around. It's not gone away. It is mutating inside everybody that gets infected. And God knows how many thousands there are. There are more than 2,000 documented. So surveillance, early warning systems, preparedness, public awareness, and immediate reaction of tracing and locking down. I think those are the kind of things we can do to not to suffer this fate again. Thank you.
I think
So
very useful.
Avi, you got
a few questions on fatty liver as well. What precautions are you going to just move on to?
Sure. So I'll quickly take 2 or 3 directions in which the questions have come. One is the fatty liver and liver enzymes and bilirubin. Somebody's bilirubin has gone up from 2 to 3 to 5 to 7. So like I said in my earlier remarks, if someone's bilirubin has gone up or enzymes have gone up, either they're going to be temporary and they're going to come back down in 3 to 4 weeks, or it is quite likely that they have a pre-existing fatty liver. That fatty liver could be alcohol related or diabetes related or non-alcoholic fatty liver. And they probably missed it because it didn't cause any symptoms before. But now that COVID happened, their enzymes have gone up and they are worried. So I think that is what's happening. They need to see a liver expert immediately. And like I said, majority of these instances, they would settle down with conservative treatment. It's not going to result in anything nasty. The other things are, of course, you have to control diabetes and lipids, and alcohol has to be avoided, etc. If you're overweight, you have to, bring your weight down. So the same things which I said earlier could be the reason that, unexpectedly the liver enzymes have gone up, but they would get better if you control the precipitating factors. The other line of questioning, which I'll just address, is some people have asked, what if I've had one bout of COVID and 1 dose of the vaccine? Should I go for the second dose or not? And there are some other people who want to know if they have to repeat the exercise next year. Well, the second question is a bit easier, but it is a little more fuzzy at this point. It is likely that we will need revaccination year after year or maybe every 2 years. There is a study recently that came out about a week ago that shows that there is a protection of the infection and vaccine doses, both to the tune of 8 to 12 months. So yes, it will protect you for about 12 months at least. Since we haven't had that much time beyond 12 months after vaccination, in fact, we haven't had more than 6 months at this point. So we don't really know the answer to beyond 1 year, but it is likely from the lab studies and people's experiences with infection that protection will last a year and you may need another vaccine next year. Now, as to the question of infection plus 1 dose, is it good enough? Again, there are some data from the UK which show that there may be a good protection of 1 Pfizer dose in addition to the previous infection that somebody may have had. We have our own data from Vedanta, which Dr. Trehan knows about, where we found that people who already have antibodies or a history of COVID infection, after 1 dose, they had better levels of antibodies compared to someone who didn't have COVID before and had 2 doses. So we have this data and we are writing it up as a paper, and hopefully it will be published soon. So there is some evidence that 1 infection plus 1 dose of vaccine may be good enough, but this is not incontrovertible at present. So at present, 2 doses of vaccines is what you need. And if you've had an infection bout, then wait 90 days before you go for your vaccine. In fact, if you have any procedure scheduled, you should take the vaccine 4 weeks after the procedure or 2 weeks before the procedure.
Perfect. I think that's very, very informative. I know there are lots of questions. There are at least another 50 questions, but I know we're running out of time. So with your permission, if I could just compile, we would get these questions compiled and maybe send them to you if you can, because I'm not sure whether you have more time given the fact that all of you are very busy doctors. So with your permission, yes, Amrish.
I think just one point which deserves reiteration is that diabetes is not a contraindication to vaccination. There are still so many questions on that in the chat box. If you have diabetes, it's all the more reason to get vaccinated and vaccinated fast. That's very important. Don't need any special tests. Don't need anything. You should, of course, control your diabetes, but even if you're uncontrolled, don't wait for it to be controlled. You just get your vaccine regardless of what kind of diabetes you have. So that's very important. Still, people are, every day I get these calls, my sugar is high. Can I get a vaccine? Today, this morning, it's 200. Can I go for my vaccination? Yes, you can. Please get your vaccine, regardless of your diabetic status.
Perfect. So with your permission, can we extend for another 5-10 minutes, or should we send you the questions, or would you like to give, maybe you give some closing remarks. The questions are in front of you. So I'm aware that all of you are very, very busy. doctors. So if you'd like to give any closing remarks in addition to what you've just said.
I've done mine.
Perfect.
It was a pleasure. Like I said, it was very, it was very, very engaging, the interaction. And I hope people who participated have benefited.
So
and
we'll maybe send you some of these
happy to address the questions. Yeah, sure,
we'll try and send you the unanswered questions if you can, address those. And it's really reassuring, I think, for all of us to know that so much research has been done by all of you individually as well as collectively within the institutions you're with. And hopefully, as and when there is a third wave, we are in safe hands. We will be far better prepared for the third wave, and hopefully we will not have the same kind of panic as well as fatality that we had in the last wave. Thank you so much. With that, I'm handing over to Dr. Harsh Mahajan to give the formal vote of thanks. Thank you all for being here.
Thank you very much, Ashwajit. It was really a very engaging, very informative session, and done in without using any of the medical jargon that most of the big doctors are used to. So thank you very much, Dr. Trehan, Dr. Arvinder Soin, Dr. Ambrish Mithal. These are really the stalwarts of the healthcare field in the country, and we are so fortunate, lucky, and honored to have them on the Meradoc platform. And as you can see, we hit the peak as far as the number of people who could join was. And in addition to that, we have so many other social media platforms where this is being shown live. So thank you all very much. And we hope that, a few weeks down the line, we may get you all back again, because this has been a very dynamic learning process during this pandemic. And every 2 weeks, we learn something new and have to course correct. I would be failing in my duty if I did not thank the London School of Economics Alumni Association of Delhi, who've been very active. Masosa, the Modern School Old Students Association, IPA Global, and Ashwajit, and of course, the Heartcare Foundation of India, Dr. K.K. Agarwal Research Fund. Dr. K.K. Agarwal, who is so dear to all of us, a very, very close friend of mine, and who gave his all during this pandemic in educating masses at large. In fact, there used to be 100,000 people listening to his webinars and his talks, and we really miss him dearly. But I do know that wherever he is, he would be again healing and teaching and training in that world as well. So thank you all very much. And we look forward, Ashwajit, to the next webinar. Thank you, Meradoc.
Thank you so much. Thanks. Thank you once again. Thanks a lot.
All the best.
Okay.
Thank you.
Thank you, sir.
Thanks, Ashwajit and Harsh.
Thank you, sir.
Thank you so much. Thank you.
Bye-bye.
Thank you.